be changing a patient's wound and cleaning it. So before I start, I'm gonna look at the MD order, and I'm going to see if the patient's in isolation, and he's not in isolation, so I'm not required to wear PPE. And I'm also going to see if the patient has any allergies through the MD order, and he's not. So then I'm going to enter the room. I'm gonna knock on the door. I'm gonna wash my hands. Then I'm going to identify myself to the patient. After I identify myself, I'm going to ask the patient to identify himself, and then once he identifies himself, I'm going to check his wristband to make sure it's the right patient. After I check his wristband, I'm going to explain the procedure to the patient, and once everything's okay, I'm going to start the procedure. So I'm going to start by raising the bed to a proper waist level. Okay. And then I'm going to pull the rails down. Okay. Then I'm going to put on wash my hands and put on some gloves to inspect the wound. Okay, so I'm going to remove the covers from the patient, only showing the wound, nothing else. Make sure the patient is properly covered. And then I'm going to inspect the outside of the ABD pad, make sure there's no drainage or any odor, and I don't see anything. So then I'm going to remove the ABD pad. Okay, before I remove the ABD pad, I'm going to put on the pad, because I'm going to be performing irrigation, and this will prevent the patient from getting soaked. So I'm going to put my pad under his leg, tuck it in, and then I'm going to remove the ABD pad. As I remove the ABD pad, I'm going to use the push-pull method. So I'm going to push down on his skin while I pull the tape from the corners. Okay, then last but not least, I'm going to pull from the center. And once I pull, I'm going to check the ABD pad to see if there's any drainage or any foul odors or anything like that. And I do see a bit of drainage, red drainage with a foul odor. Okay, so after I inspect the ABD pad, I'm going to dispose of it in the garbage. Okay. Once I dispose of it, I'm going to inspect the wound. Make sure there is no swelling. There's swelling on the wound. There's swelling. You can see a little bit of redness around the edges with some blisters on the sides. Okay, so once I inspect the wound, I'm going to measure the length and width and depth of the wound. So I'm going to measure the length, then I'm going to measure the width and the depth. Okay. So once I'm done measuring, I'm going to take off my gloves, throw them in the garbage. Then I'm going to chart down my measurements on a sheet and record it. Once I'm done recording, I'm going to start setting up my stereo field. Before I start though, I'm going to wash my hands. Okay, so I'm going to start setting up my stereo field. First, I'm going to grab my stereo package, check for the date, make sure it's not expired, make sure everything's okay. I'm going to set it on the table. Going to pull from the edges. Then I'm going to remove my package. Pull from the other edge. And face it with the blue side laying on the table. Okay, then I'm going to center it. After that, I'm going to start introducing my objects to the stereo field. I'm going to start with my gauze sponges. I'm going to check the date, make sure everything's okay. Then I'm going to open it and drop it 6 inches away from the sterile field. I'm going to set this to the side. Then I'm going to get my ABD pad, check the date, make sure everything's fine. I'm going to drop it and dispose of the wrapper. Then I'm going to get my cotton swabs. I'm going to check the date and open it and drop it 6 inches away from the sterile field. Then I'm going to grab my syringe. I'm going to pull it out the packet. Once you drop it into the sterile field, I'm going to put the container on the side. Then I'm going to put my tape on the side and my topical cream. And I'm going to grab my saline solution. I'm going to look if it's opened or not, and it's not open. So I'm going to open it myself, and I'm going to date the time I opened it with my initials, and I'm going to open it. I'm going to put the cap facing up, and I'm going to pour it into the container with my palm covering the tag. Okay, so once I pour it, I'm going to put my bedpan under the wound to prevent it from spilling when I perform the irrigation. So after that, I'm going to set up my sterile gloves after that, I'm going to start my ointment. I'm going to open it, and I'm going to pour some in the corner. And I'm going to grab my cotton swab and pour it on it. Okay. Then I'm going to start setting up my sterile gloves. I'm gonna open it from the top and the bottom, and from the sides. And I'm gonna grab the opposite end. Grab the opposite end, with the cuff facing up. Grab the other end, tuck my fingers under. Slide my hand through. Then at the end, I'm gonna roll down my cuffs from the outside. Okay, now that I got my sterile glove set, I'm going to start for my irrigation. I'm gonna grab my syringe. Okay, so I'm gonna start setting up. I'm gonna grab 3 gauze sponges, pour them into my solution for cleaning the wound. Then I'm gonna set 3 to the side for drying it. Then I'm going to set 2 to the side to cover up my wound. Then I'm gonna rearrange my ABD pad and my cotton swabs. And last but not least, I'm going to start using my syringe and fill it up with the saline solution. I'm gonna start by taking the cap off and filling it up. Okay, so this is gonna be the hand holding the syringe is gonna be my sterile hand, and the opposite hand is gonna be my non-sterile hand. So I'm gonna use this hand to hold the bedpan as I pour the saline 1 inch away from the wound. And I'm going to be pouring it until the saline is clear. Okay. So I'm finished. I'm going to dispose of the syringe in a sharps container. Now I'm going to set the bedpan to the side. After I've irrigated irrigated the wound, I'm going to take off my gloves. Throw them away. And wash my hands. And put a brand new pair of gloves. Okay, so now I'm going to start cleaning my wound. So I'm going to grab my cotton swab. Now I'm going to wipe from the edge, from the top, start from the top, go all the way to the bottom. I'm going to get rid of throwing the garbage. I'm going to grab my other cotton sponge and wipe it down from the other edge, from the top to the bottom. Throw it away. And I'm going to grab my last one and wipe it down from the center. Throw it away. Now I'm going to dry it. I'm going to grab my cotton swab and then pat it dry from the edges, from top to bottom. I'm going to do the last one in the center. Okay, once my wound is dry and ready to go, I'm going to collect the culture sample of the wound. So I'm going to grab my cotton swab that I filled up, that I put ointment on earlier, and I'm going to slowly collect the wound by rolling it. Okay, so once I collect my culture, I'm going to put it in a bag, and I'm going to label it, write where I collected it, the date, and the time. Okay, so now I'm going to finally dress my wound. I'm going to grab my 2 sponges. I'm gonna put one in the top, and since it's like an open wound, I'm going to press it down to make sure it covers up the entire area. And I'll grab my other one, place it on the bottom. I'm gonna pat it down to make sure it covers the rest. Once that's set, I'm going to dispose of the cotton swab, and I'm going to place my ABD pad on the wound. Then I'm going to get my tape. I'm going to tape the edges. So I'm going to take off my gloves. Put them away, wash my hands. I'm going to keep going. And last but not least, I'm going to cut out a piece of tape and label it with the date and time with my initials. And I'm going to place it on the center. Okay, once that's done, I've properly cleaned and changed the dressing on the wound. Now I'm going to cover up the patient. I'm going to remove the pad. That's good. Now I'm going to cover up the patient. Make sure he's feeling fine with no pain. After he's feeling fine, I'm going to lower the bed. And raise the rails up. And after that, I'm pretty much done.